Today's subject is recurrent malignant Phyllodes tumor of breast. Let me discuss something before the entering the main subject. Let me tell something about breast anatomy. We all know actually these are the subject is very much known to everybody. Still, to introduce today's presentation, I had to take some support from Google, that is a Cleveland Clinic, and some research based and some papers also there from. So let me start. Breast anatomy. The breast anatomy of male and female is slightly different. Female breasts have milk ducts and glandular tissue that aid breastfeeding. All genders can get breast cancer. Women are more prone to benign, non-cancerous breast disease. And what are the breasts? Actually, breasts are part of the female and male sexual anatomy. For females, breasts are both functional and sexual, bringing pleasure. Male breasts don't have a function. The visible parts of breast anatomy include the nipples and areolae. What are breasts made of? Several kinds of tissues from female breast muscle. These words I am going through, it's all supposed to be known to all of you. Several kinds of tissues from female breast muscles connect breast to ribs, but they are not part of the breast anatomy. The different types of breast tissues are glandular, also called lobules, glandular tissues that produce milk. Fatty tissues, the tissues determines breast size. Connective or fibrous tissues, the tissues hold glandular and fatty breast tissues in place. Then normal histology of the breast. Normal female breast is seen as lower part with ducts and lobules in a fibrous stroma, along with adipose tissue. Along with adipose tissue, which forms the bulk of the breast volume and mainly determines breast size. During pregnancy, the ducts respond to estrogen and the lobules hypertrophy in response to the progesterone levels. So, what parts make up breast anatomy? There are, once again, I am telling you, before entering the main case presentations, which has been cured, I have to discuss something about the physiology, anatomical part of the. What parts makes up breast anatomy? There are many different parts for female breast anatomy, including lobes. Each breast has between 15 to 20 lobes or sections. Each breast has between 15 to 20 lobes or sections. These lobes surround the nipple like spokes on a wheel. Glandular tissues, lobules, these small sections of tissues found inside lobes have tiny bulb-like glands at the end that produce milk. And another is milk and mammary ducts. These small tubes or ducts carry milk from glandular tissue, lobules to nipples. The nipples is in the center of the areola. Each nipple has about 9 milk ducts as well as nerves. Areolae is the circular dark-colored area of skin surrounding the nipple. Areolae have glands called Montgomery's glands that secrete a lubricating oil. This oil protects the nipple and screen from checking during the breastfeeding, and as well as it prevents infections. It prevents the breastfeeding baby infant from getting any infections. The Montgomery tuberculosis secretes the secretion. Blood vessels circulate blood throughout the breast, chest, and body. And lymph vessels, the immune system heard from develop part of the lymphatic system. These vessels transport lymph, a fluid that helps your body immune system fight infections. Lymph vessels connect to lymph nodes or glands. found under the armpits, in the chest, and other places. Nerves, nipples have hundreds of nerves endings which make them extremely sensitive to touch and arousal. Now, let me tell you the fibrous stroma that making the bulk of the breast and the fatty tissue making the bulk of the breast. In case of Phyllodes breast tumor, there is some difference that as well as epithelial tissue and stroma both are present in the developed in the breast, and the original etiology is yet to unknown. Still, it is taken postulated that some external factors, that is trauma, etc., injury, any kind of breastfeeding and emotionals, everything, and hormonal disorders, hormonal changes affect the epithelial tissues and the stromal tissues to develop it. Now, let us see how does the breast work. Female hormones, namely estrogen, progesterone, and prolactin, play a key role in breast development and functions. Now, estrogen stretches milk ducts and helps them create side branches to carry more milk. Prolactin promotes the production of progesterone and prepares glands for milk production. Progesterone increases the number and size of lobules in preparation for breastfeeding. This hormone also enlarges blood vessels and breast cells after ovulation. You may experience swollen tender breasts. Let us see common breast diseases. Most women experience breast changes at some time. Their age, hormone levels, and medicines they may take cause lumps, bumps, and discharges, fluids that are not breast milk. If you have a breast lump, pain, discharge, or skin irritations, your healthcare provider. Minor and serious breast problems have similar symptoms, although many women fear cancer. Most breast problems. Some common breast changes are fibrosis, that is lumpiness, thickening, and swelling, often just before a woman's period. Cyst, hello, fluid lumps, fibroadenomas, solid round rubbery lumps that move easily when pushed, occurring mostly in younger women. Intraductal papillomas, growth similar to warts near the nipple. Blocked milk ducts, milk productions when a woman is not breastfeeding, and Phyllodes tumors. Today's subject, hyperplasia, ductal or regular, and fat necrosis and oil cysts. So let us tell about see over the recurrent Phyllodes tumor of the breast and transforming to a fibrosarcoma. The source I have extracted, that is ResearchGate, 24th April 2023, and also American Cancer Society. Phyllodes tumors, about it, they are telling that it's a rare breast tumors that starts in the connective tissue of the breast, not the ducts or glands, which is where most breast cancers start. Most Phyllodes tumors are benign, and only a small numbers are malignant, cancerous. You can say it is mere 10 to 15% only. Phyllodes tumors are most common in women in their 40s, but women of any age can have them, and women with and there is a rare inherited genetic condition have an increased risk of Phyllodes tumor, that is from many syndromes. Phyllodes tumors are often divided into 3 groups based on how they look under a microscope. But as it is a rare tumor and rare chances of malignancy, see most of the cases in Phyllodes tumors are benign. Most of the cases benign, that is not, the tumors account for more than half of all Phyllodes tumors. These tumors are the least likely to grow quickly or to spread. Number 2, borderline tumors have features in between benign and malignant cancerous tumors. And third number is malignant cancerous tumors account for about 1 in 4 Phyllodes tumors. See the ratio. 1 in 4 Phyllodes tumors, there is cancer. These tend to grow the fastest and are the most likely to spread or to come back after treatment. Diagnosis of Phyllodes tumor. Phyllodes tumors are usually felt as a firm, painless breast lump, but some may hurt. Some may hurt. They tend to grow large fairly quickly, and they often stretch the skin. Sometimes these tumors are seen first on an imaging test like an ultrasound or mammogram, in which case they are often hard to tell apart from fibroadenomas. The diagnosis can often be made of a core needle biopsy, but sometimes the entire tumor needs to be removed during an excisional biopsy to know for sure that it's a phyllodes tumor and whether it's malignant or not. How do phyllodes tumors affect your risk for breast cancer? Having a benign phyllodes tumor does not affect your breast cancer risk. Let me repeat again. Having a benign phyllodes tumor does not affect your breast cancer risk. If you have a malignant phyllodes tumor, it does not affect your risk of getting other type of breast cancer. Still, you may be watched more closely and get a regular imaging tests after treatment for a phyllodes tumor, because these tumors can sometimes come back after surgery. Phyllodes tumor of the breast are characterized by having both an epithelial as well as stromal components, and these usually comprise almost 3% of all fibroepithelial tumors. They are exceptional in this aspect to convert into a stromal sarcoma of the breast after multiple recurrences. In this case report, we present a case report of recurrent phyllodes transforming into a breast fibrosarcoma in a middle-aged post-menopausal women. Introduction: phyllodes tumors or biphagic tumors can be identified by its leaf-like architecture due to its intracanalicular growth pattern, cleft-like space lined by epithelium, and hypercellular stroma. It is postulated that this hypercellular stroma is the reason behind the phylloid formation of the phyllodes tumor. An approximate data statistics have revealed that it accounts for less than 1% of total breast malignancies, having attributed for about 2 cases per million women annually. See in the ratio, it is told that it is 1% of total breast malignancies, having attributed for about 2 cases per million women annually. Phyllodes tumor of the breast have a propensity to transform into a breast sarcoma on recurrences following surgery, but an unusually low incidence. Phyllodes tumor with sarcomatous differentiation run an extremely aggressive course, therefore delay in its clinical diagnosis and treatment approach leads to unfavorable prognosis. On the basis of histopathological features, phyllodes tumors are stratified into 3 main varieties as benign, borderline, and malignant. They are exceptional in this aspect to convert into a stromal sarcoma of the breast after multiple recurrences. Histopathological examinations and immunohistochemistry of the lesion were performed to confirm the diagnosis of breast fibrosarcoma. Let me tell you, all the participants, learned doctors, physicians, and others who are here present here, non-medical persons. Up to now, whatever I have discussed, it is from, I have already mentioned that extracted from ResearchGate, American Cancer Society, Cleveland publications. And now I am entering the press presentation. First of all, the image now I'm showing. See, this is not the picture, real picture of the case I have treated, because when the first time at 2018, when the patient came to me, let me tell you with honestly that I myself scared of seeing the situation, and that time it didn't come to my mind that I should take a snap of it. Now today I am presenting this image from the source Spandidos publications to just make everybody to understand how dangerous it becomes. And it is not the picture of my patient. At the end part of the this presentation will show the real picture of the patient right now. So this is the histopathological report to 2003, 16 June. See, there was a Phyllodes tumor and it was benign at first time. It was a benign tumor and the biopsy was carried out and it revealed benign, and it has been operated in 2003 in Kolkata. Thereafter, 2005, it again came back, and that time it was operated at Christian Medical College and Hospital, Phyllodes, and you can see specific mastectomy with axillary clearance and level 2 lymph nodes, and it was shown clinically malignant phyllodes, recurrent phyllodes. See, after 2003, once it was operated, then again that time it was benign in nature, biopsy clearly shown benign in nature first time. You can see phyllodes tumor, benign cystosarcoma phyllodes. In 2005, it becomes malignant one. Okay. Now, the most interesting thing, at the same time, one sample it showed that it was a malignant phyllodes, and another sample it showed phyllodes tumor or borderline malignancy. Means this is a rare case of breast tumor, and which starts with benign, but after that it transformed into borderline malignancy and malignant itself. Earlier, I was telling that there are 3 categories of phyllodes tumor up to now found out, that is benign, another is borderline, and another is malignant. In this case, you easily can see that at the same time, when it becomes malignant, at the same time there was few relations of having borderline malignancy, and in few samples it was having malignancy. Now let me enter the case. This is a case of a 58-year-old post-menopausal woman. The histopathology showed feature of fibroadenoma. She had undergone a lumpectomy at left breast in June 2003, following which she was symptoms free for 2 months, and then the lump started growing again. In 2005, it has been operated once again at CMC Phyllodes, recurrent phyllodes tumor, left breast of borderline malignancy, as well as malignancy diagnosed on 11/5/2005, and that time she has taken, after operation at CMC Phyllodes, they suggested, at the patient was from West Bengal, they suggested her to take 25 radiations at Chittoranjan Cancer Medical Research, Kolkata. After 3 years, again it has been developed at the back at the same site on 2008. See, recurrent, why it is recurrent? Why it is recurrent? It by nature it is recurrent. See, in 2003, then it is on 2005, and again it is on 2008. Since then, she was under homeopathic treatment, and let me tell you, her husband himself is an homeopathic doctor. Patient name is Suchitra Baito, South Chobbish Pargona, West Bengal, and her husband is Dr. Kiriki Baito. Since then, she was under homeopathic treatment for 2 years elsewhere, but not under treatment of her husband. But the treatment was not working, and it was ever increasing in nature, and out of dismay, she stopped taking that treatment. And thereafter, that is 2008 to 2010, Mrs. Suchitra Vaidya was taking homeopathic treatment for 2 years elsewhere, but as it was not responding well and it was ever increasing in nature, and out of dismay, she stopped taking the treatment. Thereafter, her husband, or sometimes as palliative purpose, and he told me that, doctor, I have given sometimes some medicine, but it was in ever increasing in nature. Now the case I visited first time on 2nd October 2018. That is Gandhi birthday, 2nd October. Okay, it was a special day for every Indian. Since then, she was under my treatment, and I have treated her for this purpose. For this purpose, let me check. That is end of 2019. End of 2019. It's nearly 1 year or almost 1 year. So now the presenting situation was that it's a tremendous growth, large as much as big size coconuts. What I can say, it's the size just like what I am showing you by hand, because it is not the there is no picture of that time. That time actually let me tell you honestly, I got scared seeing the situations, and for past 15 days seeing the patient, the condition, I told her and her husband that you please go back to your home and please arrange some conditions so that as I will start giving her treatment, once it will drain or burst or something what has happened, you have to properly brace it. So on that day, I didn't give her the medicine, but I have taken the case entirely, and I studied for 15 days over the case. Then on the 2nd October, since I have started giving him medicine. So what are the other features? There was, she has been suffering from rheumatic heart disease, mitral stenosis, and remains under at that time allopathic treatment in PG Hospital, Kolkata, and she had leukorrhea for 30 years. She couldn't sleep overnight without sedative. She has normal bowel movement. But what were the main features I have received from the case taking? That there is an awesome silence and lack of speech over the entire case. Whatever the symptoms I have collected, that is from her husband. Entire session, it was about, for the first day, it was 1.5 hours, and the day you are seeing that my first prescription was Lactasis 0/3. For 30 days, I have given DD, and she has been declared by the attending physician of SSKM hospital that time, when she has gone with her enormous tumor before coming to me. They told her clearly and her husband that it's a very poor prognosis and they might have no time or merely 7 days, and let her eat what she wants. Now, let me tell you about herself more specifically. Actually, she's a lady of work. She can alone, even 2 days, she alone with her sickness that time, she was performing entire household activities, and her husband told me that he gets astonished where from she gets its energy, taking the large tumor at the back. It was at the left side, just adherent to the breast, at the operation site. post-operative side. And her husband told me that it is out of astonishment, how can she perform so much, even having this disease since 2003, and that time it was 2018. For 15 years, that lady was carrying the disease, and still she used to perform like anything. Used to perform like anything. You can see in Herring's guiding symptoms and Clark dictionary, and let me recall Herring's guiding symptoms and Clark dictionary, and somewhere else also in now in one's beautiful reader, the book of which I recently got, Catherine Coulter, but it is in 2023. But that time I have not gone through the book. So there clearly it is written, it was found that lachesis had that intensity, that much vitality. Actually, she works for 3% alone. And we usually know that lachesis is very much talkative, but in this case, the patient there is an awesome silence. Why? There is the main things which strike on my mind. I asked her husband, why she is so much silent? Why she is so much silent? Whatever I am asking, you are giving the answer. Why? Can't she respond, or can't she? Her husband told me, doctor, actually listening the words, the prognosis or the ultimatum from the SSM hospital, she was very much feared or shocked, whatever you can say. And this is clearly written in Herring's guidance symptoms. Lachesis with a long disease condition, the talkative lachesis becomes silent. But again, I asked her husband, is she really silent in her normal life, normal daily life? Her husband assured me, no, doctor, she used to speak a lot of, because she is talkative, she speaks a lot, and along with she works hard. So see the juncture of lachesis, you can go through lachesis in Herring's guiding symptoms. You see lachesis becomes silent with the dismay of her disease pattern, her disease condition, or apprehending the outcome of the disease. And they told me that the words the doctors used there, she listened at her, she listened herself that she had no time, merely 7 days. And after that, she became awesome silent. And my diagnosis was lachesis 3. You can see it was given twice daily for 30 days on 2nd October 2008. The size of the tumor on 17th November 2018, the size of the tumor is gradually being reduced as foul smelling discharge come out. I asked them to dress it properly, and they did it well. Came out from it, the strange smelling discharge, unbearable. If you have, I know the doctors, I should say the doctors here present, they have handled a lot of cases of cancer. Cancer cases have peculiar bad smelling stench, and even after well dressing, whenever he used to come to my clinic, that smell stuck to me, and come from it, and it is being well dressed by collaborators. So she now suffers from cough, and she has taken some. Actually, she was taking for her cardiac disorders, allopathic treatment for cardiac disorders, rheumatic heart disease, mitral stenosis. She used to take some sorts of medicines from SSKM PG Hospital, Kolkata. The size of the tumor in 1 month reduced 70%, as you can see, I have mentioned. Whatever she eats now, whatever she eats now feels salty. Her hunger has been improved. That time she was not eating well, and she now enjoys eating, but everything, whatever she tends to it feels salty. My second prescription was, see, it is latex 0 by 3.0. It was placebo for 30 days, no medicine. Reportedly, Tumour has been reduced. 22nd December 2008, it was 80%, nearly 20% means no more weakness. That time she had no more weakness in our cell, no more pain at the left upper arm. That time initially it was much pain at upper arm. He was having little cough, and the main thing, the leukorrhea that time, which was for 30 years, it was remains there, and her vision becomes hazy. I again, actually, I fear to increase the potency of my medicine, selected medicine. Again, I repeat, latex is 0 by 3. I don't know, because nowadays I don't do it, but that time, seeing the furious condition of the case, I dared to give her latex further potency. As per husband concerned, the tumor reduced to 85% in 2019. In that visit, she didn't came to me because in the time she had suffered from outbreak of very much itch for 10 days. Over phone, she told me, doctor, I don't have any problem other than itch. My all other problems are now manageable, and that time she was speaking a lot of with me over phone, which was very much absent at the first visit. And after that, a blunder was done by them, that applied some external oil, which caused immediate suppression of the skin disorder, but tremendous bleeding distress started. And now let me tell you, when I selected latex 0 by 3, that time a second thought came to in my mind, that regarding her thirst. From that time also, she was taking very little water throughout the day, but she had weight loss, and she was very polite. Whatever the this talking she was taking that time, she was very polite. And my second thought that time was wind flower, that is pulsatilla. And if you go through pulsatilla and latex, if you compare pulsatilla and latex, there are very much similarity there. Both latex and both pulsatilla, you cannot easily differentiate them, because pulsatilla also talks, latex also talks much, pulsatilla also talks much. But difference is, pulsatilla talks much to please everybody, but latex talks much to establish himself or herself, whatever you can say. And when that time the breathing distress appeared, that time I given her pulsatilla 0 by 1, wind flower 0 by 1, within 30 days on 2009, 2nd December. The tumor, the next visit, see, the tumor at the left side of the breast and back has gone. Taking the last medicine, she suffered much from old itch at whole body again. See, as I given her pulsatilla, the old itch which came after latex, it again come back. And after 15 days of taking medicine, had to stop the medication wind flower 0 by 1. See why? Her breathing distress has been reduced as well. For 1 month, she suffered from abscess condition of mouth, can't eat well. See, weight started with 45 kg, it reduced to 44 kg, leukorrhea is there. Sleeplets depends upon sedative, memory, very much forgetfulness, skin, dryness of skin becomes at someone. Actually, her skin was smooth that time, but after 15 days of wind flower, skin becomes dry and stool immediately. Actually, she was having stool long hours after waking on, but after 15 days of taking one flower, consider, she starts having stool immediately after waking on. Anorexia due to soreness of mouth. First, only merely the 1.5 liter consumed 24 hour wet mouth. I have given brimstone for 30 days. Very mildly, serum discharges out, no pain in it. Any more breathing distress, no pain nor any more breathing distress, which occurs only when cough occurs sufficiently and each turned well. The weight she gains is 47 kg. Medicine was also, you see, Brimstone 0 by 1.0, that is placebo, you clearly seen. But their problem, there starts some problem. See, the weight reduced to 45.5 kg. The tumor starts oozing yellow after Brimstone. Yellowish matter, thin, and again bad smelling, no more breathing distress, and in summer, breathing distress and cough reduces. Sleepless remains without sedatives. Leukorrhea remains, and as per her concern, when the leukorrhea reduces, she sleeps well. Now, as the leukorrhea increases, so sleeplessness remains. Thermal very much hot, skin very much dry skin at both the arms, upper part of the back, stool color well. Sometimes a bone under the left breast pains while pulsating, both the knee joints pain. It's a new symptoms. Both the knee joints start spinning. Hunger well, generally it is intolerable and cannot sleep, but she remains well with her existing disease condition. But in cold of monsoon and winter, it is gladly tolerable, but disease condition aggravates. See, in cold of monsoon, rainy season and winter, it is very much welcome to her, but her disease condition aggravates. But she feels that, well, I'm fine. I have given free of life puja on 9 June 2018. Now, see, 45.5 kg to 46.5 kg after taking the last medicine, the tumor at the left side of the back bled, and it turned well taking the medicine from third class, and at the same time, I sent her to a cardiologist. See, here, the main problem that time appeared, she was actually taking some considerable cardiac medicines, among which there was ecosprin, and she was started bleeding, but the weight was 46.5 kilo. There was no bleeding distress, but from the wounded part, there is a hemorrhagic bleeding start, and over phone, I have tried some medicine that is carbobage 30. Her husband tried hemamelis, mother tincture, and such so many drugs, but it didn't work. Then I stopped my medicine free of life, and also advised her to talk to her doctor, cardiologist. After this medication, the tumor has been reduced in size, but the doctor immediately stops the ecosprin, and the day she had stopped taking the ecosprin, from the next day the bleeding stopped. Again, I advised her to continue the medicine free of life. She suffers from leukorrhea in huge amount with slight pain at the left-sided inguinal region. Once daily she remains and for 3 liters. Her first, which was very little, now increased to 3 liters. Dry of skin, each leaving white spots, to immediately after. Again, see, I started giving her lachesis, but see, as when we if we watch clearly a onion, we see one after another starts removing when we try to have an onion. See lachesis, then pulsatilla, then brimstone, then tree of life, then again brimstone. One after another, the case is presenting itself. See her weight increased to 48 kgs. From the left-sided breast, growth, but the growth remains same. There is some blood-smelling discharges, very much hot and takes double fan effect. So hot she becomes. Leukorrhea abundant discharge. The leukorrhea starts discharging like anything. Blood pressure 120/80, and here I tell you, I became confused that time. What should I do? What should I do when I see the leukorrhea again become abundant? I don't know. It was a mistake, or that time I felt that I was in doubt. What is actually happening in the case? She was telling that I am fine, doctor. She was that time she was talking freely, but she keeps on telling that I cannot recall anything. Forgetfulness is very much, and she keep on telling doctor the leukorrhea, as the leukorrhea has started, my memory become weakened. Previously, when as she showed me the earlier prescriptions for 2 years, were that time also the leukorrhea at the beginning of the case. I told that she had the leukorrhea for 30 years. That time, I have seen the prescriptions of her doctors that time, lot of aluminium and some kind of leukorrhea drugs she was advised to take, but it didn't work. Now, I don't know this prescription on 14th September 2009. I was not very much sure about this prescription. I was not very much sure about this prescription, but I gave her. See the change from 48 to 49 kilo. See better, sinus better, blood pressure is 7, left ring finger joint lock, bad smell has been reduced, leukorrhea has been reduced. This puja there acted well. Now, on 3rd November 2009 to 2009, she didn't came. Now, 3rd November she came to me, and then I again gave her lachesis and lachesis 200, and that time she was talking like anything. Really, even her disease with, she was smiling, she was talking, and she was making prank, everything. And I have watched the real picture of lachesis. She talked like anything, not only her diseased conditions, get over, ignoring her diseased conditions, she was talking lots of, other, and she was talking about that she will bring her relatives to you, doctor, such and such. Lots of talk, speaks was there from. I have given lachesis 200. See, and the next visit was 1st of February 2020. It was placebo. Her weight gained 50 kilos. I have started the treatment at 45 kgs, and now it was 50 kilos. See, leukorrhea abundant, breathing distress, very mildly. She slept well. Now she suffers from pain in joints, left finger joints lock, pressure, everything normal. Since after the last medication, see, now the dreaded corona COVID-19 started 1st of February 2020. After that visit, there was no treatment thereafter, and over phone on 18th August 2020. Was that the breast tumor near the left breast turned well and there is no problem thereafter. It was over phone. She came to me, started taking treatment. Now she is under my treatment from 22 July. Here she is her picture. This is the point where the large tumor, the awesome tumor, as large as like a coconut, appeared, malignant Phyllodes tumor. The photo taken on 11th July 2023. Now see the case. Now let me tell you one thing about the prognosis. Anything can be told, but before telling anything, one who is telling about a patient, he or she should know that we are doctors, we are supposed to give treatment only. We should not say this way that your life expectancy is so much, because I am not claiming that I have given her the life. It is not, but actually her life was given by Almighty God. She had the life for herself. God has her life. God has kept. God has a plan. So still she is there with us. But thing is, when this is her now picture, but when she came to us, it was a thin, scrawny lady and dark colored, and now she is beautiful. And let me tell you, her cardiac medicines also have been reduced lot of. Her leukorrhea almost subsided, and now she is taking treatment from me for her knee joint pain.
Okay, it was a very nice case, Dr. Biswas. One thing about him is that he is a very passionate homeopath in our area. He is very, very passionate about the subject, and it got reflected in his case because he had that courage, he had that, persistent with, he didn't leave the case. He didn't leave the case midway. He was confused sometimes, but he fought along with the case. Congratulations. Thank you very much. This is a learning case. I must say this is a very, very, very much learning case. We have learned many things. One thing I have learned from him today is the silent aspect of lachesis. That was very wonderful. We know the loquacious aspect of lachesis, but over here today, he presented very nicely the silent aspect, as has been told by Dr. Herring. This is one learning, that we can go for these cancerous cases. We can make them we can reverse the pathologies. That's a good learning from Dr. Biswas. Continue with this thing. Congratulations. Thank you.
Thank you, Dr. Subhashis. This like terminal case you handled homeopathically and with so many hindrances, like his heart medicines were continuing, his medicines for sleeplessness was continuing. In spite of so much odds, you took all the cares for the patient, nicely progressed. I am an old practitioner, and particularly this type of case I have not seen in my practice. But 2 points, so far my observation goes. Number one, miasmatical anamnesis has not been taken care of. You started with lachesis, very good, very good, very good. But when the skin eruptions came back, or when the arthritis came back, at that time, we could have think some anti-miasmatic considerations. Number one. Number two, the fantastic result you got. the loquaciousness of the lachesis, what she had earlier, stopped after getting the shock. That reappeared after your medication. It is a good sign. And even says the theft character of a person who is naturally, who have the tendency to steal, if he become very much gentle, very much, or more simplifying, I am this, if an irritable man who is regularly irritable from his very childhood, after medication, if he become good, it is not good. His irritability should come back. Your loquaciousness of the lachesis, what was he normally enjoying, or what was his with her, that has come back. It is a good sign. Prognostically, your medicine was going on in right way. Why I am telling anti-miasmatic anamnesis has not been taken care of? Because this is a very much relapsing case. Hemorrhage was there too much. Antipsychotic, antisodic you have given, but probably anti-tubercular will be required in future after consideration the whole phenomena.
Thank you, sir. Thank
He
you,
is
sir.
having glandular affection, she is having hemorrhagic tendencies, she is having recurring tendencies. So anti-tubercular drug probably will be required to prevent further recurrence or to prevent any untoward situation. Thank you, Subhashis, for presenting the case, what you have done, not any kind of fabrication you have made. For that reason, you are very much, I will congratulate you, because nowadays whatever presentation we used to get are mostly or occasionally fabricated. This case absolutely without any touch of bookish knowledge, absolutely practically what you have done, you have lectured it, you have presented it. Thank you, Subhashis, and I wish you all the best in future cases too. Thank you.